Hello and welcome again to yet another episode of Hair Talks by Terra Medical. My name is Dr. Joshua Chong, and in this episode we'll be talking about the use of microscopes in quality checks for FUE grafts. So almost every hair transplant practice in the world has one or more of these. A specific microscope placed in the operating room to check grafts that have been extracted from the patient's skin. This could be in an FUE dominant practice or an FUT dominant practice. What you Google and you'll find that most of the preeminent surgeons that are associated with the ISHRS or the ABHRS would have clinic setups that involve microscopes in the operating room. But now with black market clinics sprouting out just about everywhere, we see the use of technicians being the main surgeon extracting the grafts, which is illegal and not allowed under the best practice guidelines from the ISHRS. And also the quality checking of the grafts are done very haphazardly without the use of surgical microscopes. And worse still, some of these clinics even put these images of untrained technicians cutting up grafts on a lit board with just the magnification loops of maybe 2 times without using any surgical microscope on their promotional ads. Guys, that is a red flag. Now let me tell you why the microscope is really important. In FUE and FUT surgery, the units of surgical samples we're dealing with are very, very small. We are talking about hair follicle units, maybe 5 millimeters deep and less than 1 millimeter across. You cannot really see quality of the grafts with just the naked eye or just with minor magnification. Anyone serious about pursuing a career in hair transplant is going to invest in good quality Mantis microscopes or their equivalent. And all the established surgeons all around the world will have their technicians check and dissect the grafts under a microscope guidance. So these microscopes are placed in the operating theatre. There is conversation between the surgeon and the technicians looking at the grafts under the microscope. Are the grafts of good quality? What kind of damage has been done to the grafts during the extraction? How many grafts we are getting in different proportions of single hair bearing grafts, grafts that have 2 or 3 or even higher order number grafts. So what an FUE surgery might look like would be a surgeon anesthetizes the patient's scalp and starts extracting grafts from the donor area. These grafts are then handed to a technician, and the technician is giving continuous feedback. Are the grafts long, short? Are there fats in the graft? Are the grafts mostly triples or doubles, or do we have lots and lots of singles? Are there miniaturized hairs? Are there grafts that have been damaged? Now, if you do not have the use of surgical microscope, you may miss some of this very important detail. If these details are not fed back to the surgeon real time, the surgeon may not be able to alter the technique in order to get the best yield in this harvesting. Any injury or damaged grafts are documented down and recorded down in the patient's surgical notes, because these can be then referred to later on if the surgical outcome at 12 months or 18 months has not been sufficiently good. And if you do not have an optimal surgical outcome and you do not have these records to refer back to, you're really just making a guess as to why the surgery went wrong. And you're unable to give the patient a good answer if he wanted an explanation as to why you promised result A but delivered on result B. While FUE technology has advanced a lot in the last 10 years, we're talking about using robotic FUE, hybrid punches, punches with different modes of movement at different phases in time. FUE may not still yet be a perfected process, and we are still chasing the holy grail, which is a zero transaction FUE. Now, in any FUE procedure, there will be some degree of transactions of the grafts, and here are some examples. This is a partially transected graft. This graft possesses a crushed dermal papilla. This graft is not really damaged but has one strong hair and one miniaturized hair next to it. This is not a damaged graft, but this is a graft that contains one full, complete white hair and is still very suitable for implantation. Now, having seen that, Would you still trust a clinic that used non-microscopic dissection of grafts, knowing that the technician just has 2 times magnification with just a lid board underneath? The next time you're consulting a doctor for a hair transplant procedure, ask to see their surgical room setup or their operating theatre setup. Or ask him if he uses surgical microscopes specific for hair transplants in his FUE or FUT procedures. To sum it up, hair transplantation operations involve surgeons and technicians dealing with really small microscopic tissue samples, and not having the suitable magnification equipment to deal with them and to process them properly is probably going to compromise on surgical outcomes. Just as how hair transplant surgeons would use magnification in order for you to achieve the best outcome from your hair transplant surgery, you, the consumer, should also zoom in on the very minor details so that you know that you are getting the best bang for your buck.